Are you brushing twice a day and still experiencing tooth cavities? Despite your best efforts, cavities can still develop due to various factors. One common culprit is our diet. Sugary and acidic foods and beverages can fuel bacteria in the mouth, leading to the production of acids that erode tooth enamel. But brushing alone may not be enough. Not flossing regularly allows plaque and food particles to accumulate between the teeth, increasing the risk of cavities. Saliva plays a crucial role in protecting our teeth by neutralizing acids and washing away debris. If you have dry mouth, whether due to medications or medical conditions, you may be more susceptible to cavity. Some individuals inherit weaker tooth enamel, making them more prone to cavities. If you have a family history of dental problems, you may be at higher risk. If you are experiencing persistent cavities despite good oral hygiene habits, it's essential to consult with your dentist. They can assess your oral health, identify any underlying issues, and recommend personalized treatments or preventive strategies. Remember, one must take proactive steps to prevent cavities and maintain a healthy smile for years to come.